Hello, I'm Matt Strelo, and this is our case discussion on burns. And so in this video, we're going to present a case of a patient with significant burns and talk about the management and evaluation of this case. Let's get started.
Morning, Carrie.
There's no attending on the floor.
Well, we seem to have a shortage.
Then don't make me come looking for you.
Can we talk about this later, please?
Okay. No, I need to know that I
Stop where you are.
I need a gurney here!
So this patient presents very dramatically, and it can be quite challenging when these patients present with severe burns or with other significant trauma. And you have to then focus in on using a systematic approach rather than getting distracted by their dramatic presentation. In this patient, given his early presentation, what are you most worried about in the first 5 minutes? So your biggest concern in the first 5 minutes of managing this patient. Let's see what happens to this patient next.
It was all a
Can't
blur.
find a femoral pulse to the SCAR.
Okay, got a carotid 2+.
You got this, but can you check on my guests? They seemed a little freaked. Hey, Sam, we need a nurse here.
Unidentified burn, the victim. No history, walked himself in.
Do you want me to start an IV or check the BP?
Yeah, fine. Access vitals fluids, let's go.
This patient's now in our emergency department and looks pretty sick. So at this point, what do you think of this patient's airway? Are there findings that are concerning you? And how are you going to manage this patient's airway and its treatment? And then also, you can see that they said that they needed to get intravenous access in this patient to give the patient IV fluids. How are you going to get or obtain access in this patient? What is your plan? And what are you going to do if you are unable to get peripheral IV access? Okay, let's see what happens next and how they answered these questions in this patient.
Lungs are wet. He's very tacky.
Be the line, please.
I'm working on it.
Tranquilo, señor. ¿Cómo se llama? Dime qué pasó.
Morphine and fluids, we need access, Sam.
I know.
No
Limbs
idea.
are
He doesn't know
fried.
what happened.
Worry about IG after you've got him on monitor and start a Foley to document renal function.
Got it. 18 gauge on the left anticube. A leader wide open. Feet and perineum are clear burns.
Sam, what are you doing?
I'm gonna hang saline.
I can see that. Why?
Because fluid requirements are 4 cc's per kilo.
Good. So you're familiar with the Parkland formula?
Yeah.
Well, then you must know that lactated Ringer's is the preferred crystalloid.
Excuse me?
Oh, Dr. Kovac, I'm Eve Payton.
Our new nurse manager.
It's Kovac.
Sets her down to 78.
This is a bad time to start pimping the nursing
Those
staff.
times are usually the best times to learn.
Didn't Yoda say that?
Suction.
All right, you've got this, Eve. Why don't you come with me and I'll introduce you to the bean counters.
All right.
So this patient continues to be quite ill, and they begin the resuscitation by suctioning the patient and providing some IV fluids or establishing an IV. Initially, when the patient was being evaluated, one of the doctors said that the patient's lungs were wet. Lungs being wet is another way of saying that the patient has pulmonary edema. So why did this patient have pulmonary edema? Secondly, this patient had a fairly severe burn, obviously, and we hear often about the term burn shock. When in a patient's course do you typically see burn shock? What time? And during that time period that you'll see burn shock, what are some other causes of hypotension that you should keep in your differential diagnosis that can present around that same time frame. And then finally, They mentioned the Parkland formula in giving the patient 4 cc's or 4 milliliters per kilogram. They're using the Parkland formula to calculate that patient's fluid requirements. That's making the assumption that they were going to use either lactated ringers or normal saline. Oftentimes people discuss using colloid solutions in these patients. So is there a benefit to using colloids in the resus of burns versus using just crystalloid? Okay, let's see what happens next.
No family, no address.
The guy was in pain, okay?
Well, I'll go up with you in case he wakes up.
Maintain the peep around 10 and tell the unit they need central monitoring on this guy.
You didn't even get a name.
He really wasn't up for an interview. Nice way to start the day, huh?
Yeah.
So this patient is headed off to the ICU and they're adjusting his vent settings. What are the most likely causes of death or complications in this severe burn patient while he's in the ICU? So not his initial causes in the emergency department, but later on in the patient's care. And then the other thing that may be needed in this patient is something called an escherotomy. So what are the indications for an escherotomy? And I mean an escherotomy specifically in this patient of the chest, but you can also write the indications for an escherotomy of an extremity as well. All right, that concludes this case of burns and the questions associated with it.